Hi.
Hi there. Do you mind if we join you and ask a few questions?
Absolutely. Come on in. Welcome to Athletico.
So we'll start with an easy one. Can you introduce yourself and share a little bit about your position?
Yeah, I'm Kimi. I'm a physical therapist, and I'm a specialist in vestibular and concussion rehab.
So Kimi, what interested you about becoming a physical therapist?
I was an athlete my whole life. I knew I always wanted to work in the healthcare setting and with the active population.
And how long have you been a PT?
10.5 years.
So what are some of the main goals you have when working with your patients?
My main goal is to help them achieve their goals. Whether that's being able to lay down without feeling dizzy, lift something up from the ground without pain or difficulty, or even just getting back to their competitive abilities within their sport.
And can anyone start PT?
Absolutely. At Athletico, we treat anybody from infant to 100+ years old.
What's the best way to get started?
www.athletico.com, and you can search local clinics in your community, go visit them, call them. You can request a free assessment, or with direct access, we can get you started right away.
Can you tell us a little bit more about direct access?
Sure. So in most states, you no longer need a prescription to seek out help from a physical therapist, and we're considered the frontline healthcare providers that can help you get started right away. Looking great, guys.
So Kimi, what are some common injuries that a physical therapist can treat?
Most common is probably back pain or other joint pains, arthritis, rehab after surgery, or balance training after a fall.
And some of the not so common ones?
Pelvic health, headaches, TMJ or jaw pain, my specialty, concussions and dizziness, Parkinson's or other neurological conditions, and like I mentioned before, pediatric therapy.
Okay, now that we've covered treatment, what are some conditions PT can help prevent?
General exercise for cardiovascular help, strengthening for overall bone health. We offer screening tools to prevent ACL tears, as well as video gait analyses to help our endurance athletes like runners, or video throwing analyses to help our overhead athletes like baseball players.
And are all PTs doctors?
So historically, the physical therapist degree was earned in a bachelor's program and then a master's, but after 2010, all schools in the United States transitioned to a doctoral degree. Hold for 30 seconds, do 3 times on that side, 3 times on that side, I'll be right back.
So when should someone seek help if they're living with pain?
That's a great question. So I think you should seek help anytime you feel something is not right. So there are too many times that one tries to self-diagnose. Let us help take the guesswork out of it and help you right away.
Is pain something that you should push through until it goes away on its own?
You can, but pain is a warning sign that something is different. So if pain is persisting or worsening, that's not the pain you want to work through.
What can someone expect during their session with a physical therapist?
So in the evaluation, it's one-on-one time with the therapist and the patient to evaluate and come up with a plan of care together. Then in the sessions, the physical therapist helps manage the plan of care with assistance from the physical therapist assistants, the rehab aides, for a teamwork approach.
All right, Kimi, here comes a tough one.
Oh.
What's your favorite exercise?
Oh, that's an easy one. I consider myself a fitness-forward physical therapist, so anything functional like a squat or deadlift.
Can you show us?
Sure, we'll do a goblet squat. Usually we want to add some sort of resistance, and that's to help strengthen our lower extremities, provide some load. If someone's not appropriate for that amount of load, take away the resistance, put a chair behind them, and practice sit to stands.
Nice. That was great. Thanks for showing us how it's done. So moving on to the next question, do patients have to receive care in clinic?
Not anymore. So with our telehealth option, we can work with you from the convenience of your phone, tablet, computer. We also offer home therapy services where the therapist will come to your home and do the evaluation right there.
And what's the best way to find your nearest Athletico clinic?
Going online and searching the local clinic near you, but also searching what specialty service you might most benefit from.
All right, last question. What's one myth about physical therapy that you would like to debunk?
So as PTs, sometimes we're thought of as a high-end personal trainer, or someone's just coming in to get heat, ice, and stim and massage. But with our education and training, we are truly the primary care access to assess all musculoskeletal health.
Kimi, this has been so insightful. Thanks for having us in today.
Absolutely, we're here to help anytime.